I am thinking about literally the most difficult conversation I ever had to have with a patient. I think I can use his first name, Jim. You don't know where I was or anything else. Jim was one of my very favorite patients. We would chit-chat the day away, and we had all kinds of things in common. I remember him even coming to my house once when I was being a hippie, and I had a drum circle, and he joined me, and I knew his ex-wife, and we were friends. He was much older than me at the time, and we hugged when he came into the office. And I worked with Jim for about 6 years. His mouth was a disaster. He was coming in every 3 months for perio maintenance. He had many mobile teeth, and I was guilty of observed neglect. Because as I was watching things get worse, Jim was very resistant to moving forward and having treatment done. He had removable partials. He was not very skilled at standing close enough to his toothbrush to keep the plaque off his teeth. And one morning we're in huddle, and I remember saying to my doctor at the time, Jim's coming in today. And the doc said, "What? You love Jim? Like, why the face?" And I said, "Because the last 2 appointments I've been noticing severe decline, and although I've told Jim about it, he's refused to have any additional treatment, to take different care of his mouth, and he's refusing to see a specialist. And I know that he's on his way to losing more teeth, and I feel sick about it." Doctor looks at me and said, "Well, sounds like it's time for a difficult conversation." And I was like, "No, I think it's time for a difficult conversation." So Jim comes in, I give him a hug like I always gave him a hug, and I said, "I'm really glad to see you, and if it's okay with you, I want to have a conversation that I'm not happy about. I'd like to look in your mouth first and see what's going on." And she was like, "What's going on?" So I gloved up, I laid him back, I did the assessment, plaque score was super high, bleeding everywhere, mobile teeth, and I said, "Jim, I want to know if you're ready to make a change in your mouth, a change in your habits, and a change in how you move forward." He said, "What do you mean?" I said, "We've talked the last couple of visits that things are declining, and I'm worried for you, and I don't believe I'm in service to you anymore, because instead of me helping you maintain your health or get healthier, all I'm doing is watching you get worse. And I don't feel good about that as your friend, and I really don't feel good about that as your hygienist." He goes, "Well, what do you want to do?" I said, "Well, what I'd like to do is take care of your teeth today, give you an opportunity to make different choices. And if you don't want to make any choices, I'm afraid this will be our last appointment together." And he was like, wow, I think he was shocked. And he looked at me and he said, "I really don't know that I'm in a position to do anything different. I really don't want to go to the periodontist. And I think I'm doing the best I can to keep my teeth clean." We literally both cried when he left that day. And it was about 9 months later that somebody came and got me and said, "Jim is on the phone." I'm like, what's going on? So I answered, and he said, "Can I come back?" And I said, "Tell me more." And he said, "One tooth is really loose. I'm scared. I know you have my best interest at heart, and I'd like to come back and talk to you about making some changes." We both cried again. And although he did ultimately end up losing more teeth, our entire relationship had changed. And sometimes being honest and being direct, even when it's hard for us, is the greatest gift that we can offer our patients.